Does delaying surgery for open hand injuries increase the chance of infection? If you want to read more, then you can check out our article published in the European Journal of Hand Surgery. The dogma is that yes, if you delay surgery for an open hand injury, the chance of infection increases. But that's just not backed up by the evidence to date. However, these studies do have some critical weaknesses. The majority were small. They all dichotomized time from injury to surgery, which is, statistically speaking, a no-no. And thirdly, none of them dealt with possible or actual confounding. So we revisited this subject with the view to correcting these deficiencies. In a large prospective cohort study conducted at 2 teaching hospitals, we recruited consecutively 983 patients. We followed them up for a month, and the primary outcome was the presence of infection. The majority of patients were operated on within 24 hours. And on the face of it, the time from injury to surgery was not associated with the risk of infection. Here are the patients who got an infection. Here are the patients who did not, and their median time to surgery is very similar and, statistically speaking, not different. But clearly, this is a univariable analysis, and we must adjust for confounders. So this is our multivariable model. After adjusting for all the other factors listed here, time from injury to surgery was not associated with an increased risk of infection, or a reduced one for that matter. It stayed absolutely static. None of the other variables predicted the risk of infection, except for skin loss, which appeared to double the chance. We wanted to explore the observation that the provision of antibiotics did not reduce the chance of infection, just a little bit more, and we did so using effect modification. Firstly, diabetics are perceived to be at a higher risk of infection, and so we wondered whether giving them antibiotics might perhaps reduce their chance of infection if they got delayed. We see at baseline the difference between them is extremely small, and the provision of antibiotics didn't change their risk of infection over time, as the confidence intervals for the marginal effects overlap. And it's the same story for patients with perceived high-risk injuries like bites or crushes. Their baseline risk of infection is extremely small, and it's not modified by the provision of antibiotics. So overall, we concluded that delays of up to 4 days from injury to surgery appear to be safe. There are some limitations to our study and many more interesting details, so please do check out our paper. Thanks for listening.